One in. Thank you. Okay, well, good evening and welcome. My name is Deanne Bennett, and I am an academic manager for Aspen Dental, and I work with District 7, so all the schools within that district, which comprises basically the Midwest. Carmen Peters is my colleague. She will be assisting me tonight. I'm kind of helping with the questions in the chat. She works with District 8. So those are with the ASDA districts. Our topic tonight, we're going to talk about ergonomics, and I believe this is something that definitely gets touched upon in dental school, but I don't know as dentists how much we really pay attention to it on a daily basis, nor do we factor in just how important it is to our overall health and happiness. Um, So obviously, as dentists, we tend to get injuries because of all the repetitive motions that we do. And so what our hope is tonight is to give you some resources in to stretch those body parts or strengthen them so that you can avoid getting an injury. I am very pleased to introduce our speaker, AC Lau. AC and I go back many years. He is my physical therapist, and he has helped me through several surgeries and injuries throughout the years. And I'm really happy that he's here to share his expertise with you because it has been instrumental in my life. Um, Again, want to provide you with some tips and exercises, things that you can do to, again, stretch and kind of undo the things that you do as you see patients. Just a bit of housekeeping. If you could please mute your microphones. We will, any questions, if you will please type them into the chat, we'll be happy to um, look at those, and we will try our very best to get those answered this evening. Obviously, if there's a question that we just can't get to, we will respond back to you. And I believe other than that, I will hand it over to AC. Welcome.
Hey, well, thank you. Thank you for your time, and thank you for coming to listen to this presentation. Again, my name is AC, and the topic for today is work posture for dental professionals. Now, while we don't think about our posture regularly, working to improve it can have a long-lasting effect on the longevity of your career as well as your life as a whole. Okay, so we'll go ahead and get started. First, I'll tell you a little bit about myself. But I graduated from UT Health San Antonio in 2014 with a doctorate degree in physical therapy. And then I immediately went into a fellowship program. I ended up getting my degree in 2018, which is a fellow in the American Academy of Orthopedic Manual Physical Therapist, which is a mouthful. But that really focused on a lot of manual therapy techniques, joint mobilizations, manipulations. But we really focus a lot on what we call movement impairment syndromes. So that entails how repetitive microtrauma can cause injuries. And by that, I mean things like repeated motions that you do every single day, as well as sustained postures, which can cause damage over time. So that a lot of times leads to degenerative issues. And hopefully, if we can address some of that in this presentation, it will really help avoid people from developing that. I also have an orthopedic I'm an orthopedic certified specialist, and I got that in 2020, and I've been working in Capel for almost 10 years. Okay, so on to the objectives of this presentation. First, I just want everyone to become familiar with the injury prevalence for dental professionals and why it's such a big deal. I want everyone to understand what good posture is and how that applies to the workplace and specifically your position when you're treating patients. And hopefully we can teach you a few exercises to help prevent injury and maintain good strength. Okay, so injury prevalence for dental professionals. Work-related musculoskeletal disorders have been well documented. A recent study in 2017 estimated that over 81% of dentists experienced musculoskeletal disorders, which is a huge amount, and that results in the loss of income at about 40 million per year. Now, the 40 million per year was a stat that I got from a study in 1993. So you have to imagine that that number is probably way more now than what it was back then. The most affected body areas are the neck and the lumbar region, followed by the shoulders, dorsal spine, and the wrist. Okay, so Here, I wanted to talk about kind of common diagnosis, but just due to the nature of your work, it requires a lot of repetitive motion with your arms and your wrists, as well as adapting usually awkward static positions for your head and your neck and your trunk. So one study I looked at says that static postures during treatment are usually held for about 30 seconds before you can kind of move and then return to it, while other procedures can last up to 60 seconds. So in those positions where you're there for a long time, it creates a pretty high isometric strain on your muscles, especially if you have bad posture. And that can not only be hard on the joints, but just the lack of motion impedes the blood flow necessary for tissue recovery. So if you do that all day, 8 hours a day, that can lead to a lot of overuse injuries. Here I have listed some common diagnoses, common things that dentists can develop because of their work, which includes neck pain, cervical radiculopathy, cervigenic headaches, thoracic outlet syndrome, and a few others here. But one thing that I did want to mention is a lot of times the repeated stress that you put through your body, while it doesn't hurt at the time, your body can kind of adapt to it. And one of the examples I like to use is like callus formation. Some people have calluses on their hands, and it's usually from repeated stress. Well, bones and joints respond in the same way. So if you are constantly putting strain on them, pressure through them, your body can develop little bone spurs and osteophytes, which is kind of a hallmark of osteoarthritis. So those types of things where you're putting your body in that position over the length of time can cause a lot of these degenerative issues. Okay, we'll go to the next slide here. So what exactly is good posture? So good posture is the position with the least amount of joint compression, and it's where muscles can perform optimally with the least amount of strain. So most people kind of know what this is. If I mention good posture, I'm sure at least half of you kind of sat up a little bit taller and brought your head back. So most people, when we think of good posture, we think of sitting tall, back straight, head and shoulders back. So for dentists, you just have to make sure that you're keeping your spine in a good neutral position. That way you protect your back and your neck. So the traditional idea of good posture, I've included like a little assessment on the left here, but we usually look at a plumb line assessment where there's a vertical line that goes through the middle of the body. And typically, if you have good posture, the center of your head or the earlobe is in line with that vertical line, as well as your hip, your knee, and your ankle. Okay. All right, so what is bad posture? So if you can look on this image on the top right here, so bad posture can create more compression in joints, leading to gradual breakdown and arthritic changes. Additionally, muscles have to work much harder than they have to, resulting in a lot of muscle tightness and possible spasms. So if you look at this bottom image here, for a lot of my patients, I like to use an analogy with like bowling. So if you've ever been to a bowling alley, you grab a 12-pound bowling ball and you hold it close to your body, you could probably walk around the bowling alley all day just holding it there. But you don't really see many people holding it out there because that's way harder on your body. It's a longer lever arm and it creates a lot more strain for your body, even though the weight is the same. So the idea is the same with your head. An average head, maybe 10, 12 pounds. If it's centered over the spine, the muscles don't really have to work that hard and it feels like 10 or 12 pounds. But as you lean forward, even as little as 15 degrees, that 10 to 12 pounds all of a sudden feels like 27 to those muscles. If you lean 45 degrees forward, it's a weight that feels like 40, 49 pounds to your muscles. So as you can see with your positioning with work, if you are sustained in that position, looking down for a long period of time, that creates so much joint compression and tension in that muscles and can lead to neck issues in the future. So another way that poor posture can affect your body, maybe everyone can try this, but if you sit and you kind of slouch down a little bit, and then try to lift your arm, that scapula is kind of locked in place and that just feels really stiff. And if you sit up nice and tall with your chest up, it just frees up that shoulder way more. So again, if you're sitting, working on people, and you have to move your arm for different procedures, if you have bad posture, that affects your neck, your shoulder blades, your lower back, a lot of different things there. Okay, so what can we do about it? So with your work posture, people develop a bad posture because it's easy on your body. Your muscles don't have to work that hard, but you're translating a lot of that force to the joints, which is not good. So you do have to be conscious of your posture. It does feel like a little bit more work, but you really want your muscles to do the work and not the joints in your spine and the joints in your neck. So when it comes to your head, you want to keep your chin close to your neck. So if you look at me from the side, I don't want my head to be kind of like that. So I want to keep my chin down. And if you have to look down, it's better to flex your head or kind of roll down like this. We want to avoid translating the head forward or shifting it forward like that, because that's what can create a lot of pressure at your CT junction and really make those upper traps work harder than they should. Okay, so be mindful of that when you're looking at someone and looking down, you got to roll your head versus shift your head forward. Okay, and then with your arms, you want to make sure that you're sitting up straight in your position to where your elbows are about 90 degrees, and you want your shoulder blades to be relaxed. Sometimes if the patient is positioned too tall, or if your chair is too low, people end up developing a position like this where they're holding their shoulder blades up with their upper trap, and that can, again, lead to issues there. With your wrist, you want to try to keep them in a neutral position. So neutral just means kind of in line with your form. You don't want to be working too much like that, which can create compression at the carpal tunnel. Okay, and then with the back, you also want to keep the back straight. If you look at the image on your left, the person is slouched down. You can see how the curve is the spine is curved, whereas the image on the right, it's a little bit more neutral. So if you do have to hinge forward, it's better to hinge through your hips and keep your back straight. So for example here, if you can see my back, I don't want to lean forward by just curving my body like that. I want to keep my back straight and move through my hips. So if I do that, I'm using the bigger joint in my hip, the bigger muscles in my glute, versus creating a lot more compression in the small joints and small muscles of the spine. With the seat position, if you look at the chair, the picture on the left, the chair is um, fairly horizontal, but when you look at the chair on the right, it's tilted forward a little bit. That anterior tilt helps distribute the weight through your legs a little bit more and helps keep the spine in a more neutral position. With a seat that's too flat, it kind of promotes a little bit more of a flat back or a little bit of a rounding of the back. Okay, so and then yeah, just be mindful of your patient position. Try to get as close to the patient as possible. That way your body doesn't have to move too much. Okay. All right. So with that being said, the world is not perfect. Everyone has different postures, and patients require different positioning depending on their body type or their procedure. So it's important to just be mindful of your posture and keep good alignment as best as possible. We want to just strive for improvement in your positioning rather than perfection. Because as a clinician, I do realize that some of our techniques have to be modified, and sometimes it just has to be in a different position. But um, that you can be proactive with that and do some exercises to build your body's resilience, hoping that if we build your muscle capacity, it can tolerate those positions better and give you a longer career in the dental field. Okay. All right, so let's talk about move on to some exercise and talk a little bit about some physical therapy principles and things that you can take with you, or ideas um, and rules that you can take to the gym with you. But really, we want to target muscle imbalances. So with anyone that's seated, or again, dental professionals, when you're working on people, a lot of times the anterior chain or the muscles in the front get really stiff and tight, whereas the muscles in the back, they're in a stretch position, and those are the muscles that usually get pretty weak. So we want to try to stretch the anterior chain. So stretch the muscles like the anterior muscles of the neck here, the pecs, the abdominals, and the hip flexors. Those are the ones that can get tight over time. And you want to strengthen the muscles in the back, which are the muscles kind of in the back of the neck, in the shoulder blade, and the paraspinal muscles in the thoracic and lumbar spine. We also want to really try to promote proximal stability, meaning we want a lot of core strength and stability here. That way you can move and function a little bit better with your arms. Another thing we want to consider is choosing exercises and reps and holds that are very job specific. So as I read in some of the other articles, a lot of times with dentists, you're having to maintain positions for 30 seconds to 60 seconds at a time. So while working with high resistance can be beneficial, you do want to focus on longer holds, really working on building your endurance, which is, again, very job specific, and working on higher rep counts per set. So a good idea would be to hold exercises at the end range for 5 or 10 seconds. And for the rep counts, maybe try to push it to 3 sets of 10 versus just doing, or 3 sets of 15 instead of just doing like 2 sets of 10. But all those details can really help push the endurance of your muscles and really allow you to perform your job a little bit more effectively. And then exercises in general need to be performed consistently about 3 times a week to actually make a difference. If you're doing exercises and only doing it once a week, it's not nearly as frequent enough to see a good change in the muscle strength and the muscle mass. Okay. All right, so let's go over a few stretches. We'll start with the neck. One is a upper trap stretch, but because of the positioning that a lot of people have, that upper trap can get really tight. So one thing you can do is anchor one of your arms. So you can put it under the chair or put it underneath your leg and then side bend away. You can even use your other hand to apply a little bit more pressure there. For a lot of the stretches, 30-second hold would be good, and I'd recommend doing that about 3 times there. Okay, another muscle that gets real tight is the scalene. So it's a muscle on the side of the neck here. One way that you can stretch it is just by kind of anchoring that muscle with your hand and then side bending away and then kind of looking up. And you'll feel a pretty strong pull kind of right through there. Okay, so those are good stretches for the neck. When you look at strengthening exercises, we want to really develop good, what we call deep neck flexor strength. Those are the small muscles that sit in the very front of the neck. And if people tend to sit with their chin protruded like that, those muscles get really, really weak. So these muscles are one of the better ones to really strengthen to give the neck more stability. One of the more popular ones is a chin tuck with retraction. So what that looks like is you're going to bring the chin down towards your neck. And then once you're there, you're going to try to gently shift your head back. Okay, so you can kind of work on that motion, doing longer holds to build that endurance. And you can even progress that by adding a resistance band to the back of your head here, which helps strengthen the muscles in the back too. Okay, another good exercise you can do is a chin tuck with a lift. Now with this one, again, it works the deep neck flexors. You want to bring your chin down, and as you lift your head up off the table, you want to make sure that that chin stays down towards your neck. It's almost like doing a curl. You want to avoid lifting your head and having your chin come out because that kind of promotes the position that we're trying to fight against. So with that one, chin down and then lifting up, making sure the chin stays close to your neck. Okay, so those are 2 of the better ones for cervical strengthening and cervical stability. Okay, moving to the thoracic spine, we can start with a few stretches here. One is to stretch the pec muscles here. So it's called a corner stretch. You're just going to put your hands or your forearms on the wall and then gently shift your body forward. Once you feel a comfortable but strong stretch, you'll hold it for about 30 seconds and then do that 3 times. And then another one that's really good to do is an open book stretch. So you're going to lay on your side, and then with one arm, you're going to rotate across, really trying to open up your chest. That one works a lot on the thoracic mobility. A lot of times, if we assess you in physical therapy, we'll try to determine if there's an impairment on one side versus the other. But from some of the articles I read, one of the more common positions for dentists include a little bit of a forward lean, a little bit of a forward head posture, and a little bit of rotation to the right. And it might be because most people are right hand dominant. I'm left-handed, so I might have maybe more rotation to the left. And when I check my other side, it might be a little bit more restricted. So this is a really good mobility exercise to stretch the thoracic spine. And sometimes if you're stiffer on one side versus the other, maybe you spend a few more reps that direction to kind of even it out. Okay, and then some strengthening exercises for the thoracic spine. These are 2 exercises that work kind of the back of the shoulder and the shoulder blades. But one is a pull apart where you're holding on to an elastic band. You're keeping your elbows by your side, and then you're gently pulling the band apart and then squeezing your shoulder blades together. So it works on a lot of the external rotators of the rotator cuff, as well as the scapular retractors. The next one is a row, which you can use with an elastic band or cables at the gym, but you'll just hold on to it, you'll pull back, and then you'll squeeze your shoulder blades together. Now with the rows, there tends to be an imbalance in the trapezius muscles. A lot of people tend to be over dominant with the upper traps, and that tends to be uh, true for a lot of dental professionals too. So when you work on rows or scapular retractions, you want to squeeze your shoulder blade down and back and try to avoid compensating by shrugging. And then with all of these exercises, like with the pull aparts and the rows, you want to be mindful of your overall posture. But one of the bigger mistakes that people make with these is when they pull, do a row or pull apart, they have a tendency to have that head come forward again. So be mindful of keeping a good upright posture. Make sure you maintain a little bit of that chin tuck as you do a lot of these exercises. Okay, and then some stretches for the lumbar spine include one that's called prone on elbows. And this is a theme I'm going to talk about later. But again, if you are sitting for long periods of time, whether it's working on patients or taking notes, you're always in a position where you're flexed. So the idea is you want to really stretch in the opposite direction, get a lot more extension in your spine. That way we kind of work the other direction. So prone on elbows is a real easy one, but you can lay on your stomach, prop up on your elbows and stretch your back into extension. If you are in the clinic and treating people, maybe between treatments, you can get up, take a break, move around. You can even just put your hands on your hips and gently lean back to stretch it in the opposite direction. Okay, we also have lower trunk rotations, which is similar to the open bug, but it gets the lumbar spine a little bit more. But you're just laying on your back and gently kind of rotating your legs back and forth to get some good mobility in that lumbar spine. Okay, and then some good strengthening exercises would include a bird dog, which is one where you're starting on all fours. You're trying to keep a neutral straight spine, and then you're straightening out your arm and your leg. So this is one of the better ones for what we call posterior chain strengthening. It strengthens the glute, the paraspinals in your lower back. It gets your neck and your shoulder blade too. So this is one that gets a little bit of everything. Another good one is the Superman's, where you're laying on your stomach. Usually I place a pillow under the patient's abdomen just to support the spine a little bit, and then you just lift up your arms and your legs at the same time, and it's a really good one to strengthen the paraspinals. And if you notice here, a lot of these holds are maybe a little bit longer than what you expect, but I have 10-second holds, 2 sets of 10, but you can work your way up to higher reps. Again, with a lot of these exercises, we want to incorporate holds at the end range. That way it really gets that endurance component rather than just working on strength. But I think that's an important thing to carry over to gym exercises. If you just like to work out at the gym, that might be something that you can take, and with a lot of your exercises, maybe decrease the weight a tiny bit, but do a lot more reps if you want to do specific exercises to help with your work posture. Okay, and then there are some stretches for the wrist. One of them is a wrist flexor stretch, or you're moving into wrist extension, but you're pulling your arm this way to stretch all the structures in the front, which are involved with the carpal tunnel. Okay, another good one is what we call the median nerve glide, where you are extending your wrist, straightening your arm, and then side bending your head away. So what that looks like is you're doing this with your arm, and then you're moving your head away. And that can really help stretch some of the muscles in the wrist. But the reason you're doing that is to stretch the median nerve, which is the most involved nerve when it comes to carpal tunnel. So it's another one that you can do to help decrease some pain that might be traveling down into your arm. Okay, now, these are some of the more common exercises we give to people. But again, if you are having pain and having a lot of issues, it would be good to get assessed by a physical therapist or even go see your primary care physician to see what they think. But usually we can give much more targeted exercises to people if they have issues like that. But again, the median nerve is one of the more common ones that are involved. There's 3 others that go into the arm that can be involved as well. Okay, and then some wrist strengthening exercises. You can do some wrist curls, going into both extension and flexion. And then you can even do some rotational type stuff, working on pronation and supination using either the weight or a hammer. A lot of times I like the hammer because if you hold onto the handle, the weight is distributed more to the top and you can get a little bit more strengthening that way. Okay, and then some other tips and guidelines. So the exercises are good to do, but it's got to be a little bit of everything. You can't do 30 minutes of good exercise, even if you do it every day. But then if you go to work and kind of slouch and have bad posture, those exercises won't win out versus 8 hours a day. So it's got to be a combination of being very aware of your posture and doing some exercises to strengthen your body, and that'll help again prolong your career and give your muscles and your body a little bit more resilience. In addition to that, you can look for ergonomic equipment to help give you more support. Again, I'm not a dentist, but some of the articles I read said that some of the saddle seats can be more effective in getting your back in a neutral position versus other chairs. And ideally, if you can find some procedures where you can do them standing instead of sitting, that would be helpful too. But again, that's kind of I guess more so your call and which procedures would be appropriate for that. And ideally, you can have breaks between patients. I'm not sure how realistic that might be depending on your caseload or how many treatments you have per day, but if possible, you can get up between each procedure. Yeah, at least stand up, walk around, maybe stretch in the opposite direction just to stretch out your back and your neck, and then you can kind of go back into the next patient there, into your work. And then we usually have a saying with PTs, but it's the best posture is your next posture, which essentially means that static positions are not great for your body. So whether it's sitting or leaning forward and working on someone, if you can get up and move out of that position and do it often, that would really go a long way in protecting your body. Okay, so other tips and guidelines. In general, just try to live an active lifestyle, which could be as easy as going on a walk 20 minutes a day. You want to be active because the job can be a little bit, I wouldn't say sedentary, but you're in a static position for a long time. Look into other core strengthening activities, such as yoga or Pilates. Uh, One research article I read even said that of the different types of physical activity studied, yoga was one of the more beneficial for decreasing pain once symptoms were already present. So I think it probably speaks to the fact that if you're stretching and working extension, it kind of helps reverse what you are doing throughout a normal day. Another consideration I'd say is maybe avoiding hobbies in the same position, but I've treated a lot of people where, if they're sedentary or work on a computer all day, that's one thing. And then their hobby is cycling or gaming or other things like that, where they're again in that position. So, not saying don't do that, but be mindful of it. And, you might need to work a little bit harder with your exercises to really reverse what you're doing throughout the day. Okay, that's not what I had, but we discussed common injuries for dentists. We kind of try to define what good posture is, what bad posture is, and how you should be positioned at work. And we reviewed some exercises to maintain your strength. And then I'm going to go to this slide real quick, but here's a lot of the good articles I read about positioning, how it affects, how your posture at work kind of affects your musculoskeletal system. And one of the providers that I found online was this lady here, Bethany, who's a PT. I think she actually wrote a book on it. So if you have a little bit more questions, hopefully I can help you answer it now. But there's a lot of resources here that you can look up to help you in the future. Okay, any questions there?
If anyone wants to put a question within the chat, that would be awesome.
But it's kind of ironic while I was doing my research because there was one right here where they were talking about a kinematics study. Where was it? Yeah, I think it was this one. It wasn't physical therapists that did this, but they were just analyzing kinematics with posture. Talked about all the issues with dentists, and they did mention one of the other professions that have a high incidence for injuries included PTs. So I was like, oh, there we go. And for us, it's a lot of wrist stuff because of all the soft tissue work that we do with people.
Okay, so AC, one of the questions came through. It said, "What is a nerve glide?"
Oh, sure. Yeah, that's a very good question. So uh, there are a lot of stretches that you can do that works on muscle flexibility. So for example, if people want to work on hamstring flexibility, they just bend forward and stretch that muscle. There are different types of stretches called nerve glides that are meant to stretch the nerve in its entirety and can help with radiating pain. So, for example, people might have sciatica or nerve pain that travels all the way down the leg. They can have something called cervical radiculopathy, where a neck issue causes pain that radiates down all the way into the arm. So, the main difference between a nerve glide and a regular muscle stretch is we're trying to put a little bit of stretch or tension through the nerve throughout the entire component of the limb. So, for example, with I'll use sciatica because it's probably one of the more common things that we see and most people have heard about it. But if you want to do a hamstring stretch, you might just gently bend down and stretch that hamstring. If we want to add a nerve glide to that, we might also dorsiflex the ankle or lift it up towards you. And sometimes we might even influence it by moving the head into either flexion or extension. But the idea is the nerve, it starts in the brain, goes all the way down the body. So we want to stretch it over all the components, including, the neck, the hip, the knee, and the ankle. Whereas a regular hamstring stretch, you just kind of lean forward and it just gets the muscle. So again, yeah, those glides can be very effective with people with nerve type pain or nerve issues.
And AC, would you say that's one of the reasons that you would hold it for a longer period of time? Some of the glides?
Not necessarily. I'll kind of go back to some of the glides there, but some of the glides you don't have to do too long of a hold. Sometimes if you're working on muscle flexibility, so for example, like some of these stretches here, the pec stretch, we're holding for 30 seconds, the upper trap stretch and the scalene stretch. We hold it for a long time because stretches, if you hold it for a longer period of time, it helps promote more creep in the tissue, or it allows the tissue to become a little bit more elastic and stretch. Nerve glides, typically, we start with just 5-second holds. If you put too much tension through the nerve and people are still irritable, it can possibly flare it up a little bit. So nerve glides we tend to keep with shorter holds, and we just kind of move in and out of that position a little bit more frequently versus doing a long hold.
Perfect. Okay, thank you. Okay, another
Mhm.
question. Some good ways to get rid of persistent muscle knots.
Yeah, so there's kind of theories as to why muscles become knotted up. So one big issue is when people come in saying a muscle is tight or they feel knots. The muscle might not necessarily be short. It might be knotted up because it's either overworking or there might even be an underlying joint dysfunction. So it's kind of a loaded question, but if you want to treat the knots itself, sometimes stretches can be helpful, or even like a trigger point release. But a lot of times with either a tennis ball or a foam roller, you can apply deep pressure to that muscle, and if you hold it for 2 minutes or more, it creates a little bit of an impulse to some of the stretch receptors, the muscle receptors, and it allows it to kind of relax a little bit. Now, while trigger point release, massages, and things like that can be helpful, sometimes they tend to come back, and that might be because of, again, some underlying issue, whether it's joint stiffness in the joints below it, or again, a posture where you're really overworking that muscle, which causes it to develop knots over time. So, again, short answer is trigger point release, massage can be helpful, but it really needs to be assessed to determine the root cause of why that is knotting up to begin with.
Okay, thank you. Okay, how about a question about bursitis? Any recommendations for exercises for bursitis?
Yeah, so that kind of it relates to my whole talk about like repetitive microtrauma. So when we see bursitis, that essentially means that there's a bursa or a sac of fluid that is usually over the joint that gets inflamed. Now, the bursa, it's meant to help promote more smooth motion between some tendons. There's a big one right at the hip. I'm not sure if that's the one that they're asking about, but there's one right at the greater trochanter where it's a big muscle or a big bony prominence, and there's a bursa right there to help with the tendon motion. So bursitis, again, it's inflammation in the bursa, and we got to try to figure out what the root cause of it is. So initially, if you want, I guess the quick answer, it can be maybe some stretches would be good for that, and some ice and compression can help. But again, that tends to come on because of some repetitive issue. A lot of times for the hip example, it can be a lot of hip abductors that are weak, including like the gluteus medius, and it would require some good strengthening there to give that joint a little bit more stability. So again, sometimes people hate PTs because our answer is always it depends. But I'm trying to give you a quick answer of ice and stretches, but a lot of times it's more of a strengthening protocol that would help prevent it from getting irritated repeatedly over time. But most of the time, bursitis is a repetitive injury and not technically like a traumatic injury majority of the time.
Okay. So, what are your thoughts on wearing a brace to maintain good posture during the day? Is exercising, stretching more effective?
So exercising and stretching is more effective. And the reason is because a brace, while it can correct your posture and make you sit the right way, your muscles don't have to work. So you might be doing yourself a disservice because over time, those muscles will eventually get weaker and weaker because they don't have to work throughout the day. And then if you're ever ready to get rid of that brace, then all of a sudden those muscles are just out of shape, deconditioned, and they don't really activate and function the way that they should. Now, we do recommend braces sometimes for people if they are in a significant amount of pain or they really do need that support, but we tried to get them out of it as quick as possible.
Okay, sounds good. Um, Question is, I know that having good posture is a result of working on several things, but if I really wanted to focus in and see some improvement, would you recommend strengthening, focusing on the core?
Sorry, can you clarify that? Would I recommend strengthening the core? Is that what the question is?
I believe that is, yes. Like, I
Okay.
believe, like, and I think you had mentioned possibly too, like, exercises such as yoga or Pilates,
Oh,
but yeah.
sure. Yeah, to get the biggest bang for your buck, and especially since I'm talking to a lot of dentists here, the core, the lumbar spine, thoracic spine, that would probably be some of the better exercises you can do. But if you really want to work on your postural strength, working on your paraspinal strength or the muscles in your lower back, doing those Supermans or those bird dogs would be really good. Again, there's a lot of other exercises that we can add in to make the program more comprehensive, but you can do side planks to work your obliques. You could do either dying bugs or crunches to work the front of your core too. But yeah, the core strength is definitely a huge component in your postural strength and endurance throughout the day.
Okay. So question is, if one of us has an existing condition such as scoliosis, should we go to physical therapy prior to joining the workforce, or would it be more beneficial to begin once you enter the workforce and are working full time?
I think the sooner you could address that, the better. I mean, there are different degrees of scoliosis. A lot of them, if they're mild enough, doctors won't really recommend anything. But anytime you have a lateral curvature of your spine, there's usually a conjunct rotation that's associated with it. So there might be a muscle imbalance, not only anterior posterior, but lateral as well. So you might have maybe the right paraspinals that are a little bit shorter and tighter than the left or vice versa. It depends on the side of the curvature. So going to a PT or another type of professional can assess that and give you exercises to try to stabilize that or even correct that a little bit if they can, so that it will allow you to function better in the workforce. But if you wait till after you're working full time, and I mean you can do that, but you do want to try to be proactive about it and address it as soon as possible.
Okay. How often should a dentist see a physical therapist for a checkup?
Yeah, I like that answer. A lot of people tend to see us only when they're in pain. And that's usually at the point where that repetitive microtrauma has passed the threshold and is now painful. So, I wish the system was a little bit different, but there are a lot of PTs out there that can do like assessments or tune-ups and give you a lot of exercises to work on your own. And then when you're ready, you can kind of return to them for more. So it's really dependent on the person, depends how active you are already. But if you already like to do yoga or Pilates or jog or exercise on a regular basis, it might look like maybe just once or twice a year you can see a PT or a provider that you trust to help give you some strengthening exercises specific for your condition, or it can be more often if you're having symptoms or strains or other things like that. But we have some pretty independent patients here that they might want to just get a tune-up and progressions of their exercises. Then they do it for by themselves for a few months, even up to a year. Then they call back and ask to do it again. So
Okay, sounds good. Well, as of now, that is all. Looks like all the questions that we have. If there's anyone else that's on that would like a question, and if my answer to the slide question, this about saving the stretches slide. Again, this our webinar has been recorded and it will be shared with you. And hopefully, again, if there's anything specific, please reach out to me and I can definitely screenshot it. But sounds like everyone has all their questions answered. Well, thank you all very much for your time. AC, thank you so much, sir. I really appreciate you taking time away from your family to join us this evening and share your knowledge. And thank you for everyone for joining the call. Really appreciate that. And other than that, have a great evening. All right.
yeah,
Thank you.
thank you.